2019 nCoV is the seventh coronavirus attack in history of mankind, which already made Wuhan, China a ghost town while making a global health threat. It started in December 2019, putting the entire world at risk as we are more mobile and connected with each other than ever. This is a brief fact-finding documentary on the severity of the possible damage this can cause to the future of mankind and measures you can take to increase the possibility of survival. For 2 years, scientists have been researching on novel pathogens resistant to any treatment or vaccines before a mysterious virus takes hold of whole Southeast Asia this year. An unidentified lung infection was found in more than 40 people in Wuhan, China in December. The deadly coronavirus has turned Wuhan in central China into a ghost town. With witnesses describing the bodies lying in deserted streets and medics patrolling in hospital surroundings. Shocking footage posted on social media has revealed the extent of the infection, with video showing people suddenly collapsing to the street in broad daylight. Other footage showed chaotic queues and brawls erupting in hospitals, as the epidemic continues to wreak havoc. People can be seen lying motionless on the ground in the city, which has been placed on an unprecedented lockdown following the outbreak of the coronavirus. In one disturbing clip posted online, a man can be seen lying unresponsive on the floor of a hospital while medics wearing hazmat suits and gas masks attempt to help him. The victim, who was wearing a protective mask, had apparently been waiting in line for paperwork when he suddenly lost consciousness and collapsed. Another horrifying video shows a man reportedly dead on the ground with blood pouring from his head, as two men in hazmat suits try to move him onto a stretcher. These viruses are very common in animals. They live and spread in pigs, domestic and wild birds, dogs, cats and camels. For some reasons that we do not understand, the virus in the animals make a link and jump into humans. Only 7 coronaviruses, including this new one, have made that jump into humans. The majority caused a common cold-type illness. For 2 viruses, severe acute respiratory syndrome or SARS and Middle East respiratory syndrome or MERS, have been much more deadly. Between them, they have infected 10,000 people and killed almost 800 worldwide. The first people to be infected with this coronavirus are usually humans who have close contact with animals. For example, in case of MERS, the virus jumped into camel workers. Coronaviruses spread through droplets when a person sneezes or coughs. They can also spread when a person touches something such as a staircase, which is contaminated with droplets and then touches their nose, mouths or arms. If a super spreader catches the disease, they can spread into a disproportionately large number of people. Once it is in a wider population, health workers are most vulnerable, because the symptoms are like any other respiratory illness such as pneumonia. Infected will have a cough, a running nose, a headache, a fever, a sore throat and a feeling of being generally unwell. Scientists yet do not know why coronaviruses mutate and there are still no treatments or vaccine for them. In a world where people are more mobile and connected than ever, we cannot rule out the possibility of further spread. The fear is, if the virus mutates, it can race around the world infecting hundreds of thousands. There is currently no vaccine to prevent 2019 nCoV infection. The best way to prevent infection is to avoid being exposed to this virus. However, as a reminder, CDC always recommends everyday preventive actions to help prevent the spread of respiratory viruses, including, wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces. Avoid alive or dead animals, animal markets, and products that come from animals, such as uncooked meat. These are everyday habits that can help prevent the spread of several viruses. There is no specific antiviral treatment recommended for 2019 nCoV infection. People infected with 2019 nCoV should receive supportive care to help relieve symptoms. For severe cases, treatment should include care to support vital organ functions. People who think they may have been exposed to 2019 nCoV should contact your healthcare provider immediately.